All right, so this is my suctioning video. And before we get started, I'm going to talk about the different types of suctioning. So we have nasopharyngeal suctioning, which is what we're doing today. And you measure that from the nose to the earlobe. That's about 3 to 4 inches. We have nasotracheal suctioning, and that would be from the nose to the earlobe to the bottom of the neck here, and that would be about 8 inches. And then we have oropharyngeal suctioning. So you measure from the mouth to the earlobe. That's about 3 to 4 inches. And then we have orotracheal suctioning. So mouth, earlobe to bottom of the neck, that's about 6 inches. If a person has a tracheostomy tube, you really can't pre-measure for that because there are different sizes and you don't know what size necessarily the person has, or there's really just no good way to pre-measure, but no more than 6 inches on that one. So this one, like I said, is nasopharyngeal suctioning, so we'll get started with that. So I'm going to come in. Hi, I'm Nurse Lynn, and you are?
Deborah Madison.
Deborah Madison. I'm going to check her armband, make sure she is who she said that she is. And we're performing this procedure because maybe I've heard some gargling or some adventitious breath sounds, or her heart rate's increased, or her O2 sats have dropped. She's becoming restless and agitated, and it's just indicative that she needs to be suctioned. So the first thing that I have done is I've washed my hands, and I'm coming in and I'm going to put some hand sanitizer on just because I always do double measure. It's just a good idea. I'm going to put a gown on, a mask on, and then I'm going to put some gloves on. Just some regular gloves. This is a sterile procedure, but for now we're going to do clean technique here for a minute. And I am going to place this over my patient as well. Keep her protected, her clothing protected. And I'm going to turn on my suction. Here's my suction canister, and there's a tube attached to that. And so I'm going to set this for 100 to 150 for an adult, 100 to 120 for a child, and 50 to 95 millimeters per mercury for an infant. This is an adult, so we set it to 100, 150. Yep, I can hear it. It sounds like it's working. Okay, so I'm going to lay that off to the side for a minute. Make sure this is where I want it. So the next thing that I'm going to do, I'm going to get rid of these gloves. That's what I'm going to do. So I'm going to want to open up my package here away from me. As I said, this is a sterile technique. And so first thing I'm going to do is I'm going to open up this box, figure out which way it goes without touching the inside of it. Set that up in front of me here. Here's my sterile water, sterile saline, sorry. Put the lid upright. We're going to lift some of this into the trash can. That removes some of the bacteria from the top of the bottle. And we're going to pour some into this little receptacle thing here. And we're going to recap our bottle. Let's just set that off to the side. The next thing I'm going to do is we are going to put on sterile gloves. Be very careful not to break our sterile field. Naturally, they're going to stick together. I've got 2 fingers wanting to go in the same hole, but I can't fix it right now, so I'm going to have to fix it in a minute. So I'm going to cuff underneath this one here. Now I can fix my fingers. Okay, so I'm going to take this and pull it out of the packaging. And as I said, I'm going to keep this sterile. Both hands are sterile right now. So we're going to measure, since it's nasopharyngeal, we will not touch the patient. We don't want to break our field. So nose to earlobe, it's going to be about 3 to 4 inches. So I'm going to keep in mind that that's about where I need to go. I'm going to wrap the rest of this like this. And now this hand's going to become dirty. I'm going to grab the tubing off of the suction canister and plug that in. Okay, and we're going to make sure that it's working. All right, so we're going to put a little bit of this water in here and suction it into the catheter. Okay, so we're ready to go now. So we will begin inserting. Our thumb will be off of the suction tube as we insert. So we're inserting in, and on the way out, we're going to do this within 15 seconds. So we're going to press our thumb down on the suction catheter on the way out, and twirly, 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 twirly on the way out. The reason that we twirl is it helps to prevent tissue damage so it doesn't get stuck to any section on its way out. So then we're going to clear out our tube a little bit here. We have to wait 30 seconds in between suctioning. If at any time our patient needs hyperoxygenated, if it's before or after or during the procedure, we would hyperoxygenate at any point in time. She seems to be doing okay. We don't need to hyperoxygenate, but she still sounds a little gurgly to me, so we're going to do another pass. So again, we're going to suck some of the water through our tube, and we're going to insert and go in to our marked area, and then our thumb would be on the suction on the way out, and we would be twirling, twirling, twirling on the way out, and clear out our tube. And Miss Madison, are you feeling better?
Yes.
Yeah, she's not gurgling anymore. She seems to be doing great. So I'm going to kind of put this in my hand like this, and then unhook, and I'm going to go ahead and get rid of this trash. And turn off suction. If she was on oxygen prior to the procedure, then we would go ahead and put our oxygen back on her. Make sure that she is comfortable and her call light isn't within reach. I don't know if I stated it at the beginning of the video, but she would be in the semi-Fowler's position to do this procedure. I should have said that at the beginning, but anyway, so that's it.